My name is Joseph Zulu. I'm a professor in the School of Public Health at the University of Zambia. And together with a team of researchers and peer interviewers, I did a study on the mental health of young men who have sex with men. We wanted to understand how these young men were coping and whether they experienced any mental health problems and if they had sought professional help for those problems. It's important to understand that homosexuality is illegal in Zambia and is considered a criminal offense by law. Because of this law, gay people in Zambia often do not feel free to express themselves and live freely. We found that the young gay men we interviewed were facing a lot of stigma and discrimination from the communities they live in, and often lacked family support because of their sexual orientation. When we conducted the research, we included peer interviewers who played a key role in our study. We called them peer interviewers because they themselves were young gay men from Zambia and understood the community context and the social and psychological pressures on our study participants from a first-hand experience. The peer interviewers assisted us in finding other young gay men and invited them to become participants of the study. The peer interviewers carried out all the interviews, transcribed the interviews, and helped us analyze the data. The peer interviewers received training from us on how to conduct interviews and how to process the data afterwards. They were also supported in how to deal with their personal feelings when listening to the stories of stigma and discrimination from the study participants, especially as the issue was so close to them. We had debriefing sessions with them to talk through their experience and emotional responses during the interviews, and we supported them throughout the whole research process.
This was the very first time that I had an opportunity to part of such a research. It was very insightful and knowledgeable in being part of the very first people to do a research on such a topic. At the beginning, it was quite a bit tense in the sense that here's a total stranger who you're trying to ask about personal questions about their personal lives. So it was quite tense in the sense that I needed to soften the ground to build a rapport to make the participant or respondent comfortable with me, for them to share the most intimate details of their life, the things that they've gone through, the abuse, the violence, the stigma, discrimination, things of like suicidal thoughts, which were quite sad when you hear the stories of these people were telling about the things that they go through in their lives. So it was quite sad hearing some of the stories, trying to empathize or sympathize with them. But in the end, after building that rapport, we were able to get to a point where they opened up to me and were able to have a very good conversation. I think the most important thing for me that this represented was inclusion of the young people themselves to be part of the processes. It also speaks to the notion of nothing without us, because it also represents to not only me but also to the community that seeing a peer who is also part of the community being part of the processes, it gives them a feeling of a voice being given to them through me. It gave them the feeling of belongingness, ownership of the processes. And also not only just that, even in conducting the interviews, knowing that they are talking to somebody who's also part of the community, who also understands some of the challenges that they go through, it made things easier for them to open up to me, so they're able to give me that rich information that was needed. So basically, being part of the processes for me represented inclusion and not being left behind as young people in such processes of conducting such a research. For me, this has capacitated me to an extent to now where I'm also being part of other research studies. It taught me quite a lot. It gave me an understanding really of what the community is all about, the things that they go through. From the experience that I had from conducting those interviews on mental health, it gives me an open mind to understand that these populations go through quite a lot of mental health issues, which could lead to people having suicidal thoughts. So it has really capacitated me to the point that now I've also been able to be involved in other research studies since that very first study that we did.
The peer interviewers were very important to include in this study because we were dealing with such a sensitive topic and study participants needed to feel safe with the interviewer. We found that it was easier for the peer interviewers to allow the study participants to open up and share their difficulties of being young gay men in Zambia. I continue to work with some of the peer interviewers who have a research assistant role in the new research that I'm working on. Therefore, the experience offered to these young people is something that has transcended beyond this particular project. My involvement in this study has further enhanced my own personal understanding of how neglected adolescent health issues, such as mental health, can manifest and negatively affect the social and economic development of a country as a whole. I learned that if you neglect one group in society, many people's lives are affected.